Do you ever feel like you're doing everything right to manage your blood pressure, but health still high? You take your medication, you try to eat well, you go for walks, but those numbers just won't budge. It can be so frustrating. The truth is, many seniors make small but crucial mistakes that unknowingly keep their blood pressure elevated. Today, we'll walk through 7 of the most common mistakes older adults make when it comes to blood pressure and how to fix them. Let's get into it. Mistake 1. Not taking medication consistently. The most obvious but still incredibly common mistake is missing doses of your blood pressure medication. This usually isn't intentional. It happens because you forget. You feel fine and assume you don't need it, or you experience side effects and stop taking it without telling your doctor. But here's the problem. High blood pressure rarely causes symptoms. So even if you feel okay, your arteries could still be under pressure. Over time, that hidden pressure damages your heart, kidneys, eyes, and brain, leading to heart failure, kidney disease, and even dementia. If you're having trouble remembering your meds, set reminders, use a pill organizer, or ask your pharmacist for help with synchronization tools. If you're experiencing side effects, talk to your doctor about alternatives. Mistake 2. Measuring your blood pressure the wrong way. Did you know there's a right and wrong way to check your blood pressure? Doing it wrong can give you false readings, either too high or too low, and that can lead to incorrect treatment decisions. Here's what to do for an accurate reading. Sit quietly for 5 minutes before measuring. Keep your feet flat on the floor, don't cross your legs. Rest your arm on a table at heart level. Don't talk, eat, or drink caffeine while measuring. And don't take your blood pressure right after walking or climbing stairs. Wait until your heart rate returns to baseline. These small steps make a big difference. Mistake 3. Not knowing your sodium sources. Most people know to cut back on salt, but where's it actually hiding? Here's a hint. It's not from the salt shaker. About 70% of the sodium we consume comes from packaged and restaurant foods. Even so-called healthy choices like soups, deli meats, and whole grain breads can be loaded with sodium. Some sneaky sources include canned vegetables, unless labeled low sodium, pickles and sauces, frozen meals, condiments like soy sauce and ketchup. To get your sodium down to the recommended 1,500 millimers per day for older adults, you need to read labels carefully and cook more meals at home using fresh ingredients. Mistake 4. Not getting enough potassium. While most people focus on sodium, potassium is just as important. Potassium helps relax blood vessels and counteracts the effects of sodium. Yet many older adults don't get enough. The good news? You don't need supplements. Foods naturally high in potassium include bananas, spinach, sweet potatoes, avocados, beans and lentils, low-sodium tomato products. Unless you have kidney disease, in which case you do need to be cautious, potassium-rich foods are an easy and natural way to support healthy blood pressure. Mistake 5. Not treating sleep apnea. Do you snore loudly, gasp for air at night, wake up feeling tired even after a full night's sleep? You could have sleep apnea, a condition that's not just annoying but dangerous. Sleep apnea causes dips in oxygen during the night, which raises your blood pressure and puts extra stress on your heart. Many older adults have undiagnosed sleep apnea and don't realize it's contributing to their hypertension. If you or your partner notice these symptoms, ask your doctor about a sleep study. Treatments like CPAP or oral devices can make a dramatic difference. Mistake 6. Drinking too much alcohol, a glass of wine here and there, usually fine. But more than 1-2 drinks a day can raise blood pressure and reduce the effectiveness of your medications. And alcohol calories add up, leading to weight gain, another risk factor. If you drink, follow the guidelines. No more than 1 drink per day for women, 2 drinks per day for men, and take a few alcohol-free days each week to give your body a break. Mistake 7. Assuming blood pressure meds are all you need. Blood pressure medication is important, but it's not a cure. It helps manage the symptoms, but if your lifestyle doesn't change, your numbers will likely creep up over time, and you may need more medications or higher doses. The most powerful combination is medication plus lifestyle. Eat more fruits, vegetables, and whole grains. Get regular exercise, even just 30 minutes of walking. Reduce stress, get enough sleep, watch your weight. Small daily habits just big, long-term impact. Managing blood pressure isn't just about medication, it's about awareness, consistency, and lifestyle. By avoiding these common mistakes, you'll take real control of your health.